Hi, I'm Dr. Liana Koe. I'm an obstetrician and gynecologist, and I'm currently practicing in private practice at STONG Practice. My main interest actually lies in colposcopy, which is cervical cancer screening. And in that area, I actually do a lot of talks and I do a lot of advocating. But of course, being an obstetrician, I also deliver a lot of pregnant mummies and I take care of both mummy and baby. So NVD is an acronym for Normal Vaginal Delivery, and that basically means delivering vaginally. I don't really like the term normal because every form of delivery is actually considered a good way of getting baby out safely. But vaginal delivery is basically one of the more natural methods in that sense, where there's no surgery done and mummies deliver vaginally. Common reasons why we need to do an emergency cesarean is if the baby's heartbeat is suddenly not good and we need to get baby out quickly and safely, and there's no delivery via vaginal is not near. And the other common reason is actually because we may not open up in time. And when I say that, it means that the progress of labour can be really much longer than what we expect, or perhaps we think that baby is too big and it might be too dangerous to attempt a vaginal delivery. So I think it's very important to know beforehand what to prepare for vaginal delivery and how to manage your pain during the delivery. The most easiest way of managing pain would be using the laughing gas, or what we call the Entonox nitrous oxide. And this is a gas that is administered via a face mask. This gas helps to relieve about maybe 50% of your pain, and you breathe it in each time you get contractions to help during the contractions. Something that will help a little bit stronger would be injections via the intramuscular route, usually given by the thigh, and these are pethidine injections. So this medication is actually helping to relieve the pain quite strongly, but it lasts only about 4 to 6 hours each time. You can repeat it during the labour, but it's not really recommended towards the end stage of labour because it can cause baby some sleepiness when baby is delivered near it. And finally, we have the most effective, which is epidural, and that is something that a lot of patients nowadays are taking. In fact, I would say a majority of my patients now are starting to take epidural in labour. So this injection is actually an injection in the spine, and the medication is administered so that the half body, meaning your lower legs, is actually numb. And a lot of patients on epidural actually almost don't feel pain. It helps with about 80 to 90% of pain relief. Many of my patients are even asleep until it's time to push the baby out. So that would be the most effective form of pain relief. One of the common ways now is to do a perineal massage, starting from about 35 to 37 weeks of pregnancy. A perineal massage is basically a technique that you use your fingers to gently stretch the muscles of the vaginal opening so that during the birth of the baby, the vaginal tear is not so deep and not so big. Other ways would be there's even a device now that you can buy. So with technology, there's a device called Epino, which can be purchased very easily from overseas. And this is a small little balloon that you insert into the vaginal opening, and you start to slowly, gently stretch the muscles over time prior to the delivery of baby. And these two ways can actually help to drastically reduce the severity of the perineal tear for my patients. For first-time mummies, I like to tell them what to expect. So for delivery-wise, they should be aware of the different modes of delivery. Like we've been talking about normal vaginal delivery. Of course, there's also assisted vaginal delivery, which means forceps or vacuum, which are instruments to help to deliver the baby. And that is part and parcel of vaginal delivery because it can happen to any women. And of course, cesarean section, what to do, what are the reasons why we get an emergency cesarean, and what to expect. In this way, patients' expectations are actually managed and they will know what to do in an event of an emergency. I would also tell them about how to reduce the perineal tears, because that gives them a little bit of reassurance and self-control with regards to the delivery process. It's very important to know the pain relief as well, which we've already talked about. And of course, I like to tell them postnatally what to do. So I would let them know about how long the wound takes to heal, which is almost about 2 weeks or so. I would let them know exercises that they can do, which include pelvic floor exercises known as Kegels exercises to help to strengthen the pelvic floor and improve healing. I'll let them know about the pain relief options after delivery as well. And of course, finally, contraception, which is what to do in preparing for your next baby. So these are the few things that I would think first-time mummies would need to know. And I think it's actually very important for first-time mummies to trust your doctor. Let your doctor take care of the worries and stress of delivery, but focus on taking care of baby. So it's important to go for antenatal classes, which Thomson Medical does have, and they can teach you about how to do baby care, how to shower the baby, and how to feed your baby and breastfeeding as well. So the Thomson Medical delivery suite is really, really good. The nurses here are one of the most experienced in Singapore. There are nurses that have worked almost 30 to 40 years in a labour ward as a midwife. So my patients here feel very reassured. In fact, me as a doctor, I do feel very relieved when I have the nurses here taking care of my patients, knowing that they are in good hands. The other thing that's unique about the Thomson Medical Delivery Suite is that the operating theatre is literally a door away from the labour ward. So if in event of any emergency, such as we mentioned cesarean section, the baby can be delivered within minutes, and the time is of essence during these situations because we always want to make sure that baby's life and mummy's life is always in good hands. I would say these two are the main factors that I always encourage my patients to deliver in Thomson Medical. So you can be well assured that you are well taken care of if you deliver here.